I think there's a lot of things that happen that we have no explanation for. There are people that die when they shouldn't, and there are people that survive when it seems totally unlikely.
Yeah.
And the burning question is always why? Why did this person who should have been able to survive not? And this person who had everything stacked against them is still kicking. Why when they shouldn't?
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Good readings, y'all. Kevin McFarland here from the Art of Emergency Nursing. And first, let me say thank you for downloading this episode, and thanks for following the podcast. If you're not already following the podcast on your podcast player of choice, please do so now. And also, don't forget to follow us on Instagram. Make sure you're doing that. For this episode, I have a nurse who is pretty influential in my career. This nurse was one of the first to encourage me to join the ENA and not be a passive member, but be an active member. Needless to say, I did take that advice and took a lot of advice from this woman, and I think you are going to get a lot out of this episode. I really hope you enjoyed this episode with my friend, Adriann.
Well, I am an anachronism. I entered nursing back in the 70s from a diploma program, which no longer exists. And for anybody that knows what they are, you essentially hit the ground running from the get-go. So it was all clinical and classes and everything all together. And at graduation, once you were licensed, you were done, you were on your own. And we were on our own lot training. But the interesting thing about that is that we floated through the emergency room, and it was just a room back then, while we were in nursing school.
Oh, really?
Yeah, we helped. There was a nurse, no on-staff physician. And if you worked the evening shift floating, that you went where you were needed. And so I spent a lot of time in the ER as a nursing student. And we didn't have doctors in-house.
Wow.
And so if something came through the door, you dealt with it until, or you got on the phone and told the physician what you needed, and then you did it and they went on their way.
They'd write the orders and you'd just take care of it.
Yeah, exactly. And so it was a whole different world back then. But anyway, I spent time in med surg. I spent time in pediatrics. Until I got to press, I never worked in very large hospitals. So it was always a circumstance where ER was always a part of it, because you know, there in the facilities I worked in small towns, you had small ERs, small staffs. When big things happen, everybody kind of conglomerated to help. And so even at those times, that's what I did. But, and then I ended up managing that ER for a while, and as it grew, and then came here back in, what was it, 1994. I think it was 94.
In what year?
1994 was when I came to press.
Holy cow.
And of course, as you probably know, as a manager in the press ER, it wasn't just sitting in the office.
No, you didn't. You weren't always, you and Doyle, like you guys were always kind of around and busy and helpful. And
yeah. But you know, it was interesting coming from a little town rural hospital to a major city hospital. Some of the staff were surprised that I wasn't intimidated by the trauma and all that sort of stuff that we saw. But the issue was farm animals and oil rigs and those kinds of things make much bigger messes.
I always remember you saying that. I always remember, like, one of my memories of you is that, like, there was no shaking you. Like there was no like unnerving you. Like you'd be like, whatever.
Not necessarily. Well, let's put it like this. I hit it better than most.
Like I remember you particularly, like nothing shook you. You're like, well, I'll be fine.
Well, Well, I think I hid it better than most. It's one of those things, you don't let the panic attack comes later. You know what I'm saying?
Yep.
And I think part of it, I was in ER from 73 intermittently until 94. Well, no, I went to risk in 2007. So how many years is that? I don't know.
It's a few.
more than one or two.
Yeah.
Anyway, starting in small hospitals, you had to be ready for anything. And you were the only nurse there. And so you had to deal. And I remember one in particular. I was in the department. It was a Sunday morning or Saturday morning. And I was stocking. And all of us, ambulances didn't radio in because they were first aid. They were not EMS trained and all that. And they rolled in with a patient that was blue to the nipple line, purple to the nipple line.
Wow.
And they had oxygen on her face, and she came in and they said, her family says she's allergic to grain and she was exposed to grain dust. No doc.
Holy cow.
So I get on the phone and I called the doctor and said that said she was in anaphylaxis. And he said, okay, I'm at the clinic. I'll run right over. And I said, if you don't give me orders now, she'll be dead by the time you get here.
Holy cow.
And to this day, the only reason I remember what drugs I gave her is because the packages were, I don't remember physically doing it. I gave her Epi, Decadron, Solumed, the usuals. I don't remember doing it.
Oh, really?
I do not remember doing it. The packages were on the counter.
You're like, this is what I did.
Remember when we do codes and I always threw my bag, I always had a paper bag that I threw my packages in. Do you remember that? I
don't remember that. I remember, of course, this was when we worked together, it was all paper.
Exactly.
It was all paper. And I remember like even the med room, like you'd go in and there was like a log for everything you took out of the med room. You had to write down every little thing, right. Which to me now I'm just like going, I can't even imagine.
I can't even imagine having to stop and put it in the computer. But I wrote on my hand, I wrote on, but that's what I used to do in order to keep track of things, was to jot on the packages and throw them in a bag and deal with it later. But it was so different back then. But I think that's one of the things, you just learn to deal with things because you have to. And the other thing I learned starting in a place like that was that if you had any downtime at all, you got ready for the next thing. You didn't just say, okay, there's nobody here right now, I can coast for a while. You have to be ready for the next thing because there's nobody else there.
Yeah.
But there's dozens of people that I remember like it was yesterday. Really are.
It's kind of funny. You mentioned, kind of being busy during the downtime and making sure to stay busy. That's one of the things I always remembered about you. You were always like, come on, let's stock, let's do this, let's do that, let's get the rooms ready. And at the time, it probably didn't feel like downtime to us now or then, but boy, now I realize, like, I remember a couple of times on nights, like having a night where it would slow down about 11 o'clock and, we wouldn't really see much until about 5.
Right. That's when we had our water fights.
Yep. I remember. I remember water fights. I remember April, the charge nurse, being taped to the chair and put in the elevator. Yes. I remember that. I remember the water fight that I'll never forget. The water fight that I'll never forget is it was me, Dina, maybe it may have been Swazo, and maybe Mike Slinkard were screwing around, and we were having a water fight and messing around. And then the next thing you know, we got yelled at by Steve because there was a code coming in. We got a radio call that there's a code coming in. And sure enough, we go to this code. Dr. Henry is getting ready to do this code. And all of us, me, are sopping wet, looking ridiculous. And he was just, you remember how purple he would get when he was angry. He was just looking at us, and he was just so mad. He's like, look at you guys. And, we were all sopping wet when this patient comes in, and everyone just like kind of looked at us like, what in the world's going on here? But we were out screwing around, and like we literally came in the room just moments before the patient did. And I remember I thought he was going to kill us. I thought he was going to kill us all. And poor Mike got it the worst because he was, the responsible adult, in theory. but oh my gosh, I remember just him being so angry at us. But that's how it was at night. Like at night in the ER, like it wasn't busy. It wasn't a busy place.
It changed. It sure has changed.
It's changed a lot. It's a different world now.
Yeah, it is.
It's a different world. The cool thing is we got a chance to get to know each other. We got a chance to learn. I remember as a tech, just learning so much from the nurses, just from being around and hearing stories and telling stories. And
we did a lot of storytelling.
A lot
from that storytelling, because you talk about cases, you talk about what you did, and then maybe next time when you're faced with that, you can
lessons learned, and hey, don't do the things I did.
Yeah,
it was
exactly. And and I think the other thing that it makes it okay to, people tend to be afraid to admit that they made a mistake.
Yeah.
And people need to know that it's more important to admit that you made a mistake and fix it than it is to sweep it under the rug, because if you do that, then somebody else is going to do the same thing and all that sort of stuff. So, but one of the things that I learned a lot of when I was in risk was that if you don't pick apart every single thing that went wrong, you'll never find out why it went wrong. And many times it has nothing to do with the individual who actually made the error.
Yeah.
Factors contributed.
Yeah, a lot of.
I remember being in the room. It wasn't here. It was prior to me coming here. But do you remember when all the things came out about labeling of potassium chloride?
Mm-hmm. Yeah.
When I was working in Wisconsin, the vial that Lasix came in is the same manufacturer as the vial that where they made potassium chloride. So
the labels probably looked exactly the same.
Looked the same, except one was dark brown and one was kind of a caramel color.
Wow.
You can about imagine what happened when somebody came in a coat.
I bet.
I was there when somebody got potassium pushed. Fortunately, I wasn't the one who did it, but we had a cart in our major room where all of our med supplies came, and the pharmacy would just drop the stuff off on the top of the cart and leave it there. And then we'd have time, we'd go in and put it away.
Yeah.
Anyway, these vials were sitting on the cart, and they grabbed the wrong thing and pushed instead of Lasix. It was a horrible thing to watch.
I bet.
I mean, once it was in there wasn't much you could do except.
Yeah.
So those are the kinds of things that you don't realize, those kind of factors. But anyway.
Yeah, it's crazy to see how far nursing has come, and some of the things we did back then that now you'd look at and you go, oh my gosh, I can't believe we did that. And then there's probably some things that were like, it might be better if we actually did that. I don't know.
Well, one of the things that I still believe in to this day is that I don't care what environment you work in, how busy a department you're in, or what you're faced with. You always have time to ask questions when you're not sure.
Yep.
You look things up, double check stuff, have somebody double check stuff, and you always have time for that.
Yeah.
The other thing is, I believe that nobody has a dumb question. The dumb questions are those that aren't asked, and everybody has something to contribute.
Yeah.
This particular situation I was thinking of with your list of questions, there was a young man who was working for us as a transporter. he was 19 years old. And Jim Welty was taking care of a patient that he had worked up for chest pain. He had ruled out an MI. He was getting him ready to discharge and all of that. And he'd already gotten his instructions and he was still on the monitor. So he told this young man to go in there, take him off the monitor, help him get dressed. His family was checking him out. Well, a few minutes later, this young man comes out of the room and he says, I need you to come in here and look at this man. And Jim says to him, he said, what's going on? And he said, well, I was getting ready to take him off the monitor. And that squiggle that people describe as tombstones are happening. I don't know if that's what it is, but I think you should look before I take him.
And this is like a 19-year-old transporter.
It's a 19-year-old transporter. I mean, you remember those guys? They came in with nothing but first aid.
That's where I started in the organization. I started as a transporter with my EMT basic. My intermediate wasn't quite done yet.
Yeah, this is kind of where he was. And he was in the middle of his basic program. And he saved this man's life.
Holy cow.
He really did.
Holy cow.
This guy was in the cath lab within minutes.
That's awesome. You're like, as he's getting discharged, right? He would went home and died.
His rhythm was perfect before, like 5 minutes.
Yeah. He would have went home and died is what would have happened.
Yes, exactly.
Right?
And so, of course, you know how it was back then. You always made a big deal out of somebody that did something right.
Yeah.
And, so he was pretty proud.
That's a good thing to do, right? Praise people.
He went on to go to medical school, this young guy.
Who is that?
I can't remember his name. He was a young blonde guy, and he had a brother that was with him, but I can't remember his name. They both went to the academy.
Okay.
I mean, this was 15 years ago. I don't remember their names.
Longer than that, yeah. Holy cow!
It was really cool. It was something else.
Well, I think of some of the people that went through that place that have gone on to be nurses or doctors, and
Glenn Delaney for one. You remember him?
Yeah. No, I never knew him as anything but a doc. So
really.
He came back. He came back as a doc when I was either just leaving or not long before.
When I first met him, he had finished his 4 years of college and he was working as I can't remember exactly what his role was back then, but he was working in the ER prior to going to medical school.
Wasn't he like a huck or something, like a clerk or something?
Yeah, he was helping the docs with their
orders,
that kind of thing. But I think it was more of an honorary position. But that's when I first met him, and he's done well for himself.
That's cool.
Yeah,
that's really cool.
He's still around. That's
crazy. We're friends on Facebook, so I see him post every once in a while. No, he didn't post a whole lot.
Yeah, no, that's kind of me too. I'm more of a Facebook voyeur than anything.
Yeah, else. Yeah, I think that's probably him too. So,
anyway.
Why'd you go into nursing in the first place?
I was thinking I knew you were going to ask me that question. When I was a kid, I had two aunts who worked as nurses' aides, and of course back then they went in with the nurses that they worked with, trained them how to do things. Yeah. My mother never worked in a hospital, but when she was a teenager, she would tell about how she worked for this family that had twin babies, premature twin babies. And they hired her to look after these twins. And she said that because, of course, my thought is I think of these premature twins that end up in NICU.
Yeah.
But she fed them with a medicine dropper. And she kept them warm by they were in a drawer. And she had blankets around the cushion of this drawer and hot water bottles around the sides. And that's how she looked after these twins.
Holy cow.
To tell me about that. And I said, well, how much did they weigh? And she said, oh, a couple pounds. And I said, well, how long did you do that? And she says, probably till they were about 6 pounds. And then she said they started holding their temperature better and stuff. Until
Wow.
they actually eat, drink from a bottle and all that kind of stuff. But yeah, she fed them with a medicine dropper as a teenager.
It's crazy.
Like 16 years old.
Holy
But,
cow.
that kind of stuff always fascinated me. And I think that's where I got started. And it's just what I've always wanted to do. And I never regretted it, ever.
At what point in your career were you like totally made the right decision? You're like, this is it. This is what I'm supposed to be doing.
I think I was still in nursing school when that was
Yeah.
But, I don't know if I would have felt the same way if I had to be trained the way they do now.
Yeah.
The fact that we hit the ground running, we were taking care of real patients within months of starting.
Yeah.
And then throughout it all. And so I think it was more real for us back then. It was easier to get into, but it just was I never wanted to do anything else.
That's cool. That's cool.
Although there's, I've done different things while I've been in nursing. I've worked employee health. I've done risk management, of course, the last 10 years and those types of things in addition. Infection control I did for a while. But it's still all nursing.
In all the places you worked, where do you feel like you had the most success?
Here.
Yeah, but like in what role? Like, huh?
Turkey, I think.
No, but in what role? Like as the manager, as the director, as the risk manager? Or?
Well, I was a manager in 2 other hospitals besides this one. But I think in this particular environment at Press, the managerial role had a lot more autonomy here than it did anywhere else.
Yeah.
And so it gave you the opportunity to do a lot more things with that role and have more involvement in staff and all of those types of things. I think Press was much more involved in supporting learning than any other place I was at.
That's cool.
And so there were a lot more opportunities. And of course, when I got to the point where ER was just too physically tasking for me anymore, risk was a great transition. I was actually recruited by the staff attorney.
Oh, nice.
Yeah. I had done a deposition with him once. In a case. And he, when the previous risk manager resigned and retired, they were trying to recruit somebody, and he told the director that at that time, I had to do a deposition with this person. Why don't you see if she's interested?
Like she handled herself pretty well. She probably do okay.
Yeah.
That's cool.
Well,
that's really cool.
Yeah. But yeah, it made me feel wanted.
That's not a bad thing.
It was a good transition because, the ER nursing skills lent themselves well to that particular role.
I bet it does. I think ER. So a lot of people I know are ER nurses or former ER nurses, and they transition to other things. And I think it's a great foundation to have. And I know for the things that I've transitioned to, like it was a fantastic foundation to have. Like I always felt like I knew a little bit about a lot of different things, and had just kind of a very realistic thought of patients and the world and the system, and had a pretty realistic thought process that I think helped. When I went into like leadership roles or education or things like that. So
exactly.
Now you started in a diploma program. What made you decide to go back and get your advanced degrees? Because what degree did you finish your career with?
I ended up with a master's in nursing management is my final. But back in, I can't remember what year, it was the mid 80s. I was living in North Dakota, and North Dakota passed an entry into practice legislation that required nurses to have their bachelor's degree in order to be licensed. Now, that particular law has gone by the wayside since then.
Sure.
But back at that time, I was the ER manager at that facility, and they were trying to transition all their managers to be bachelor's prepared.
Yeah.
And so I went on to get my bachelor's degree, and I did it through an external degree program out of Maine. It was St. Joseph's College in Maine. And the reason I did that is because back then, as a diploma nurse, you pretty much had to start over.
Yeah.
And I wasn't willing to do that. And this particular program gave me credit for my nursing program.
Nice.
And so I got my bachelor's degree there. But when I came here, in order to get the managerial position at Press, I needed to have a degree in nursing. That degree needed to be in nursing. Well, I already had a bachelor's degree in healthcare administration. So that's why I ended up getting a master's in nursing management at the University of Phoenix.
Nice.
So it wasn't something that I had set out to do at any point in time, but I was kind of forced kicking and screaming. But I don't regret any of it.
Yeah.
It has been very worthwhile doing.
Yeah.
I don't think I would have ever gotten to where I ended up in my career had I not done it.
Good for you.
Of course, along with that is all the certifications.
What certifications did you carry?
Well, just the usual ER ones, PALS, ACLS, TNCC, ENPC, CEN, those kinds of things.
Nice.
When I was doing infection control, I had I think it was APIC. It's Association for Practitioners in Infection Control. I had one of those at that time. But all of those types of things, no matter what you do, no learning is ever wasted.
Absolutely.
As far as I'm concerned. And so that's just the way I look at it.
Totally agree that I have more certifications than I need. I remember when I started at my current job and they said, they're like, well, you have a few certifications. And I think I had 3 at the time. And I was like, yeah, I have 3. And they're like, okay, you don't have the one we want. But we'll give you time to get it. And I was like, do I got to get another one? They're like, yeah. They're like, those ones are good, but not the one you need. You need this one.
Yeah,
so I was like, oh, okay. So I guess I'm getting that one. And
do you remember Ken Dooling?
I remember the name. I don't know if I remember him much.
He was in the cath lab for a while.
Okay. I think that may have been, he may have been before my time.
He had his little 3-letter name and then a line of certification that went off the edge of his badge.
That's mine now. Like they laugh at me because on my email signature, it's like, like just this long string of certifications. And then now I'm like going, and now I want to go get more, right? Like now I'm like, okay, I got to go get this one. I got to get that one. And I don't know if you heard. Huh? What was that?
What's that?
What did you say?
You said, no, what was this other one that you were going to go get?
Oh, I want to get the CPEN, the pediatric emergency nurse. I had that and then I let it go. And then I want to do the transport nurse. So, but one thing, I don't know if you heard, I got accepted. Oh, Jesus Christ.
You still don't like bugs, huh?
No, still don't like bugs. It was a big old giant mosquito eating me.
Oh, I'm sorry.
I was like wondering why my arm was itching like crazy. Now I know why. I got accepted as a fellow for the Emergency Nursing Association, which is, I'll get to use that credential in October. So
good for you.
Yeah,
I'm very proud.
Thank you. It's super exciting.
I shouldn't be proud because I didn't do it, but I think I had a little bit of influence.
You did. So I got to tell you, you're one of the people that I kind of credit with having influence on my career, and in no small way.
Oh, I don't know about that.
But really, I mean, one of the things that I always credit you with is getting me to join ENA. So I remember you always were like, you got to be part of your professional organization. And I remember as soon as I told you I became a nurse, you're like, got to join ENA, got to start coming to meetings. And I was like, all right, yeah, I'll do that. That sounds kind of fun.
Those conventions that we went to, they were a lot of fun, but oh my God, did we learn. We learned so much. And not just the programs we went to, but we learned what we had to be thankful for from where we were.
Mm-hmm.
And we got to get exposed to the struggles that other people had.
Yeah.
And the solutions that they used.
Mm-hmm.
That kind of stuff. It was so beneficial in so many levels that it was hard to not go.
One of the things I always tell people is I go, you figure out you're about as screwed up as everybody else, right? So, for real though, but you go there and you go to a talk and you're like, oh my God, they really have this one piece figured out that we don't. And then you go to the next talk and you're like, here's a Ivy League school saying, hey, guess what, guys? Having a dedicated charge nurse really makes a difference in your department. And we're like going, we figured that out 10 years ago. Yeah. And you figure out that you're kind of in the middle with everyone else and you're kind of doing okay. And you share struggles. And one of the things I've found in doing this podcast and getting the chance to talk to nurses all over the world is emergency nursing is emergency nursing. And we have a lot of the same struggles all over the world. And being able to go to a conference and be able to meet other people who are doing the same thing you do and have the same struggles you have and have the same problems and challenges. Mm-hmm. It's good for your career soul, right? Like it's good for you to be like, oh, okay, we're doing okay.
Yeah, I agree.
So
the other thing, since you were mentioning talking to people from all over the world, one of the things that I think is really good for people to recognize is that it doesn't matter whether you work in a place that's a major metropolitan center with, all the resources that you can, and everything that you can possibly shake a stick at. Or if you work in a little podunk place where you have nothing except your brain.
Now, I remember
willingness. There's a level that you function at. And I have a story I'd like to tell you.
I was going to say, you always had stories of your small ERs where you got these mega traumas that I always remember hearing your stories about, like this little tiny ER and no resources. And then you have these like major traumas that come through.
Well, here was an interesting circumstance. We were in the middle of the oil patch. And we were the closest hospital in that particular corner of the state. But it was a small place. It was 6 beds. And the place where this oil rig accident happened, this fellow, I don't know how much you know about what a drilling rig looks like.
Not even a little.
All these loose things spinning around on the platform. And this young man got his leg caught in the drill stem. And it picked him up and spun him around this thing. And of course, there's all sorts of boxes and things on there that his head and shoulders were hitting as this thing was going around. And it took a while for them to get this shut down so that they could extract him from what was tangling his leg up. But anyway, he was probably 30 miles away.
Holy cow.
And, obviously massive head trauma. And so we got a radio call from the drilling boss, and all they had was a basic ambulance to respond out there to this rig place. And so that ambulance was on their way. And so to come to us was another 30 miles in, and then to go 80 miles to the trauma center.
Wow.
Whereas if they could go get there by flight, they'd cut an hour off that time, at least, at minimum.
Yeah.
So we never saw the patient. But boy, our doc was on the phone and the radio. We had a state radio system.
Yeah.
And he was on the radio managing care for this guy with the EMS crew that was on site, and then coordinating a flight crew to get a helicopter over there.
That's cool.
Pick this guy up off the drilling platform and take him to the trauma center. We never saw the patient.
But boy, your doc sure worked hard to make sure that guy was okay.
Yes, they did. And, I don't know that he completely recovered. I know he survived, but what his chances would have been had his care been that delayed, because at that time, we didn't even have a CT scanner.
Yeah.
We could not have assessed him.
Yeah.
And so, like I said, you do what you can with what you got, and you do the very best you can with what you have.
Yeah.
To make the circumstances for that person's survival or recovery as good as you can.
Yeah.
And you got to be proud of that, because you may not be the end point, but you can certainly contribute to it.
Absolutely. I think that's a
really
great
proud
lesson.
of the things we did there.
Yeah.
I remember one kid that got picked up by a grappling fork out of a barn roof with it by his hand. And he degloved the tendon, the flexor tendon in his thumb.
Oh.
Pulled it right out.
Wow. Holy cow.
Tore off the muscle back here. Well, anyway, our doc sat and cleaned and cleaned and cleaned and cleaned and cleaned and cleaned because it was covered in straw and whatnot. All the while, the transport company was coming to come get him, to take him to a major place where they had a hand surgeon, because we didn't have one of those either.
Yeah.
Well, this kid was playing basketball 2 weeks later.
Wow.
No infection at all.
Really? Holy cow.
Yeah, but our doc was cleaning the entire time from the time at our door until the transport team.
And probably for no other reason, other than he didn't know what else to do. Like he was like, let's just clean this.
Yeah, there was nothing else to do.
He needs surgery. I can't do that. Let's just clean.
Anyway, it was kind of cool.
I'll never forget. We had a patient come in when I was at press. We had a patient come in and he was a young kid and he was playing with a gun and he shot his toe. It was his middle toe, shot it clean off his foot.
Oh, ouch.
And this poor kid was like, I don't know, 15 or 16. And he was just like, of course, a mess. And there's, he was missing a toe. And then we told him, we're like, we're there, and he got there before his family did. And we kind of got started and we're kind of getting things started slowly. And then they tell him, they're like, oh yeah, your dad's here. And he's like, oh God. Oh God. And I remember Tom, I think his name was. Tom was one of the nurses there. And this kid was like, oh, guys, you need to get security here because my dad is going to kill me. It's like, I'm dead meat. And Tom's like, no, man, your dad's going to be just glad you're alive. Like he's just going to be happy that you're here and you're good and you're not more injured than you are. And he's like, nope, going to kill me. Going to kill me for sure. Promise you. And Tom goes, well, let me go out and have a conversation with him. Tom was he was a little dude. He's kind of a slight dude. And he just kind of went out there.
You're talking about, yeah. Okay.
He just kind of went out there and real smooth guy and just kind of went out there and just talked to him. I was like, so here's the deal. Your son's a wreck in there. He's really worried that you're going to go in there and just kill him because he knows he did something stupid. He knows he did something stupid. And he knows he's in trouble. He's like, however, we're working on trying to, get his toe sewn up. We don't need the drama. So let's just go in there and just be thankful he's alive. Be thankful that this is as bad as it is because it's not that bad. And he went out there and had this conversation with this guy. And this guy came back and, of course, here's this big, gruff father. And he's just got tears in his eyes. And he's just glad that his boy is alive. And it just, just that nurse intervention just kind of changed the whole dynamic. It's like, cause he probably was going to come in hot otherwise. Yeah. And I just remember thinking to myself, like, never thought I'd see this. This is kind of cool. Yeah. It's the kind of stuff you wouldn't expect to see, but you see stuff like that every day in the ER. Yeah. So there's an art to being able to talk people off the ledge. Right. Ain't that the truth?
It's not just that, it's listening to them so that you know what their fears are. Because many times what they're afraid of is so out there that it has no basis in reality.
Yeah, it's
so if you can listen to what they're coming up with, you can put that to bed before you ever get anywhere else. And that's what's nice to be able to do.
Yeah. Yeah. And that's a skill. That's a real skill. Mm-hmm. Like, I mean, the communication skills that ER nurses have are just incredible.
Mhm.
So one question I like to ask people who've been in the ER for a really long time is do you believe in miracles? And have you ever seen one?
Oh, let me think. I think there's a lot of things that happen that we have no explanation for. There are people that die when they shouldn't, and there are people that survive when it seems totally unlikely.
Yeah.
And the burning question is always why? Why did this person who should have been able to survive not? And this person who had everything stacked against them is still kicking. Why? When they shouldn't. And my personal belief about that is that it has to do with, I think it's sometimes the internal combustion of the patient themselves. It's their own internal will, so to speak. Sometimes the odds are stacked against them, yes, and there's absolutely nothing that's going to happen. But is that a miracle? Possibly. I don't know. But I think that the person's own will has a lot to do with it. And if people come in to whatever illness or condition that they have with the defeatist attitude, they're not going to do well.
Yeah.
But if they have a positive, I think they will do better. I don't know. I really can't answer that question.
Yeah.
Is it a miracle? It could very well be. Who knows? It's not. I'm not going to tell you that it's not.
Yeah. You're like,
if I need one, I want one.
It's a good point. Yeah, miracles are bullshit. And then you're like going, I really need one though.
Oh,
that's funny. That's funny.
Yeah, that's kind of the way I look at it. It's just there's no explanation for things sometimes.
Yeah. Tell me about a patient that you'll never forget.
I have lots of them in various ilks. One in particular, and I don't know if it's one you particularly want to hear about because it really wasn't an ER case, but it gives a sense of what it's like to care for somebody that you know. This was a young man that I took care of probably, I think it was like 82, 84, somewhere back in there. And remember what was going on in the early 80s. That was the beginning of the AIDS epidemic.
For my time, but yes, I've heard.
Yeah. But anyway, we didn't know a whole lot about it. We knew it was a bloodborne pathogen. We knew it was a sexually transmitted disease. We did not have any treatment options for it at all. I took care of a young man who I had worked with. He was a orderly that worked on the surgical floor. We'd all worked with this young man. He moved away. And then about 5 years later, he came back terminally ill with Kaposi sarcoma. And we took care of him during his last month of life. We were the nurses who he had worked with.
Wow.
And it was particularly difficult because back then there was so much fear around HIV infection.
I bet you guys were.
There was so much lack of knowledge. And the thing that struck me, first of all, we knew this guy. He was, you know what it's like. You worked with him side by side. And so he was like a friend.
Yeah.
And he was so afraid. And of course, back then, everybody's scared. So you go in full isolation gear instead of just bloodborne pathogens, precautions and stuff like that. And one of the things that I really learned caring for him is that he needed honesty. He needed total abject honesty because his imagination was much worse than what was really happening to him.
Yeah.
We had taken care of a man with esophageal cancer who ruptured and bled out. And he thought that's the way he was going to die because he was having trouble breathing. And to say that fear and have some contact when have this barrier between you, and I'm sure that was what it was like during the beginnings of COVID as well.
Yeah.
And so it was really an eye opener for me. And I think it was a turning point for me in terms of how I interacted with people that were in tough situations. And it was always about honesty. It was always about touching people. I don't care what you have, what you're sick with, or if you're filthy, or if you smell to high heaven, I'm going to touch you. You know what I'm saying?
That makes a really big difference.
Oh God, it does. It really does. And you may not give a rip, but it gives a personal contact, and that person knows that you're caring for them.
Yeah, a sense that you care.
Yes, exactly.
Yeah.
And I think that caring for this young guy and he died within a month's time. He eventually became, fortunately, he was unconscious in the last few days. But it was really tough. He was only in his 30s.
Wow, that's young.
Yeah, well, there was no way to treat it back.
Yeah.
So, but that was a real turning point for me in how I approach patients. It really was. And I was young and foolish back then. I mean, I was in my 20s.
You were probably. I would have loved to have seen you at that age. You'd have been hilarious. Hilarious when you were a little older than that.
Energy. The same, only a little more energy.
That's right. That's right. Well, that's one thing that, like, I always, one of the things, one of my memories of you was always that, like, you were the director, assistant director, but you were always like still fun, still willing to come out and help, still willing to do whatever you'd do whatever needed to be done. You weren't afraid to jump into any patient care scenario ever. You were just like, let's do this, let's go. But yet I remember a couple times.
While you're doing it.
Huh?
And have fun while you're doing it.
And have fun while you were doing it. I remember a couple times you came and worked nights with us when I was on nights, and we were probably short staffed, more than I remembered, because I was a tech and I didn't pay attention to such things. But you would always come and you'd work hard and you'd be there to help, and but you weren't like a stick in the mud. You weren't like like, oh, there's Adriann, be on your best behavior. I mean, we were on our best behavior. But you were,
anybody was.
but you were also, you could also cut up, tell a joke or two, tell a story or two, and be just like one of the staff, which was something I always appreciated about you. So
I think it's the difference between a vocation and a professional vocation and a job.
Yeah.
To me, nursing has never been a job. What's that phrase? If you do something you'll love, you'll never work a day in your life.
Yeah.
Well, I did that most of the time, but not always. There were days.
There's days. I said that not too long ago. So there's been days when I've been, maybe a little burnt out in the situation, or maybe I needed to change. But for the most part, I don't think I've ever been super burnt out with nursing. Like, I've always still been like, I'm good. So,
yeah.
Tell me about your time. Tell me a little bit about your time in Risk. So you then went to Risk, and how did you like that? How did you like doing?
I didn't know for sure whether I would like it at the time, because as a risk manager, what you're doing is you're reviewing any kind of event where things didn't go the way they should have.
Yeah.
And some of those can be pretty innocuous, but some of them are really big deals.
Yeah, some of them are like we're going to be writing a big fat check.
Well, sometimes it's, we didn't really do anything wrong, but this shouldn't have happened anyway.
Yeah.
And so we got to figure out why it happened. And so a lot of what I did was kind of investigational. I did a lot of work with staff, in these major events, if a major event happened, I usually work directly with the patient.
Yeah.
And so as soon as possible after the event would happen, we'd go to the patient, meet with them, find out where they were at with things, find out what their needs were, and try to help them through things.
How do you open that conversation when you're, like, for instance, you're like going, oh, we screwed the pooch on this. Like this is all us. We screwed this up or something, some just terrible thing happened just because some terrible things sometimes happen. And maybe it wasn't anyone's fault, but it was one of those, like, clearly this didn't go well.
Well, what we would usually do is we'd meet with usually the manager of that area, because it was not just nursing. It could have been radiology, could have been laboratory, could have been anybody.
Yeah.
But we'd meet with the managers of that department and have a conversation about what we know so far. And then, does the patient know about it, or do they not know about it? And press's attitude toward these things is the patient has a right to know. So we're going to tell them. We're not going to hide anything.
Yeah.
And so we would go in and say, this happened. We don't know. This is what we know. This is what we do not know. And so one of the things that was very important in doing that is don't say that we think it happened because of X when we don't know for sure it happened because it might be Y.
Yeah.
And so, because it's really hard to pull back on that. If you tell people up front that it happened this way, and then you have to go back and tell them it happened something else, then their trust is going away.
Yeah.
And so you only say what you know when you know it. And you make sure that when you have new information, you go in and you talk again. And so sometimes I'd meet with these people every few days for a while.
Wow.
And fortunately, those big things didn't happen very often.
Yeah.
And, if you can get in on the ground floor and work things out, then you can do some damage control and it never goes to a lawsuit.
Yeah.
Sometimes you just help people out.
Nice.
On one case, we had a woman who ended up with a misdiagnosis, and she became terminal, but she was the caregiver for her husband. The only thing she wanted was for her own care to be covered and for somebody to look after her husband. So we set aside a trust fund to provide care for her husband, and that's all she wanted.
That's awesome.
And her family was happy with that.
What a cool thing.
But the key is what do you need? What is it that you need from us? And that was the conversation I would have. What do you need? What questions do you have? Because their questions may not be what you are trying to tell them.
Yeah. Yeah.
And so you let them ask the questions first. And that's how you have that conversation. And we usually tried to work with staff and managers and whatnot and work with them in advance so that they didn't run themselves down an unnecessary rabbit hole and put themselves in a horrible situation.
Yeah.
Because especially when a nurse thinks they made a mistake, they tend to fall on their sword, and they shouldn't do that because that patient needs to trust them.
Yep, for sure.
And if they walk in saying, oh my God, I can't believe I did something so stupid, I can't imagine why I'm so dumb. That doesn't help anybody.
Yeah, you're like, stop talking.
Yeah.
You're like, stop talking. Just say, I'm sorry.
And we used to do a lot of EAP recommendations and counseling with staff and whatnot.
I bet.
We do a lot of teaching staff how to handle these situations before they as an individual had one.
Yeah.
And so it's not a matter of if, oftentimes it's a matter of when.
For sure. Yeah, for sure. So
those were as much as they were draining and exhausting, that was the part that I enjoyed the most. Because other than that, it's just paperwork.
Yeah, right. Other than that, it's just pushing paper and kind of solving problems and doing that kind of thing.
Yeah. Exactly.
So what are your thoughts on this? So this national trial that, of course, has had everybody's attention.
I read the article the first article. And of course, when I was reading it and it's surfaced, my first thing that I said is, oh my God, how can anybody do something so dumb? You know what I mean? That's what you do.
Yeah.
And then I got to thinking about it. And, the environment that creates that situation, our dispensing units, how are they established? How are they built? What kind of safeguards are in place? Does this person, is the environment in the department that they work in, give them the latitude to ask questions, to stop and think, to check their stuff with other people? Do the people that they work with support that questioning?
Yeah.
Because I kept thinking about that. Let me put my risk manager hat on and say, okay, what's going on here? What contributed to this person's mistake?
Yeah. How did this all go wrong?
Yeah. But do I think that she should be tried for murder? Hell no.
Hell no.
I mean, the thing of it is, this girl going to work that morning, this woman, had no intent to hurt anyone.
Nope. Not an intention in the world.
Yeah. And, I don't know what the legal definition of manslaughter is.
Yeah.
And I think that's what they were trying to get for her.
Yeah. So that's kind of crazy.
It's an overzealous prosecutor, in my opinion.
Yeah. It's kind of the impression I've certainly got.
For themselves.
Yep. Just making them the scapegoat.
And that you want to know that the biggest downfall of that kind of thing is that if these kinds of things occur or are allowed to occur, then the practitioners who are working in an error-prone environment are never going to report what they did.
Yep, it's true. It's really true.
The biggest problem you have is getting people to report errors.
Yeah.
Because they're afraid to. They're afraid of the repercussions.
And I think that's my big worry with this whole redundant thing is that it's going to encourage people to just hide and shut up and not say anything.
Yeah. And we'll be going back 20 years.
Yeah, exactly. All the traction we just made with, bio briefs and everything else. All of a sudden it's just gone, right?
Yeah.
So
that's exactly right. So that's my opinion. That's my opinion on that from my just reading the national press.
Yeah. Yeah. There's been a lot of national press on it. So
yeah.
But
anyway.
One of the last questions I always ask my guests is a question called 3 things. Where I ask them to give me 3 things an emergency nurse should always remember. And what's 3 things they can just forget? Like those aren't things. So don't do anything about that.
I wrote some things down, actually.
Yeah, I got this. I studied
for my test. I think I touched on one of the things in advance, and that is don't ever not ask a question if it enters your mind. Always ask that question.
Yeah.
If you are unsure, you ask. You may have the same answer that you did. Don't ever think that somebody knows what you don't.
Yeah.
What you think you know, those kinds of things. Don't ever stop that communication. You always have time to look stuff up. It takes a whole lot longer to clean up after an error than it does to prevent it in the first place.
My nursing instructor used to always say, there's never time to do it right, but always time to do it again.
Yeah, if you have an opportunity to do it again.
Yeah, if you get a chance. Yeah. That's for sure. So what else? What are some other things they should remember? And things they should forget?
I think what you need to do in order to function in the environment of emergency nursing is that when you go home, when you leave at the end of your shift, you need to leave to the extent you can, you need to leave that behind.
Yeah.
Because if you don't care for yourself, if you re-stew everything that went on, it's not healthy.
It's going to tear you up. It'll tear you up for sure. So,
And the other part of that is to let go of imagined slides. You know what I mean?
what do you mean by
You know
that?
what I'm talking about?
What do you
So
mean by that?
somebody wasn't quite as nice to you as you thought they should have been.
Yeah.
Well, in that environment, it could have meant absolutely nothing.
Right. You're like going, oh my God, she hates me. And she's like, she didn't think anything about you. You're not even on her radar. Not even thinking about you.
Yeah. And so, those are the kinds of things that you just have to let go of those types of things. So, but that's kind of where I'm at. And, constant learning. There's, if you think you should pursue something, an education, an opportunity, yes,
Yeah.
the answer is going to be yes.
Yeah.
You know what I mean?
For sure.
Yeah. I never intended to go into management ever.
No.
Mm-mm.
Huh. That's kind of surprising for someone who's done as well at it as you have. So.
Well, we moved away from my hometown because my husband was going to college. And when we came back, I wanted my old job back. And they told me I couldn't have it. They had a manager job for the pediatric unit that they needed to fill, and they wanted me to do it. And so I did. But interestingly enough, there were nurses hired for the unit that I had been on that were orienting at the same time I was. So I thought, well, that was a lie. And the rest is
wait a minute. Wait a minute.
Yeah.
So somebody gave you a little nudge to go to the management side of the house.
Correct.
Okay. That happens.
Yeah, but that's
Yeah.
the rest is history, and now it's kind of over. I don't think you ever stop being a nurse. You still have those same interests. I haven't practiced for 3 years. I've let all my certifications lapse and all of that kind of stuff. I'm no longer licensed, but I think you still think like one.
Yeah. I don't know if you remember Susan Salt. Do you remember Susan Salt?
I do. Yes.
So I interviewed her on the podcast, I don't know, a couple months ago.
Really?
And one of the things I remember, one of my memories of Susan is her mom was probably in her 70s, and her mom was an ER nurse, many, many, many moons before. And I remember touring her through the ER, and I said, so I hear you used to be a nurse. And she's like, she stopped dead in her tracks. She looked at me. She goes, young man, you're never used to be a nurse. You're always a nurse. Mm-hmm. She's like, whether I'm licensed or not, she's like, I'm always a nurse. She's like, I'll never not be a nurse. I am a nurse. That's who I am. That's what I do. She's like, get it straight. And I was like, yes, ma'am. Stood up a little straighter, like, whoa.
That thought process never goes away.
Yeah, no, it doesn't go away no matter what you do. And one of the things that I worked for a while, I was doing a leadership management job, and it wasn't a good fit for me. That job just wasn't a great fit. But my boss used to tell me stuff, and she'd be like, she'd want me to get upset, and she'd try to get a rise out of me. And I'd be like, it's not a big deal. Like, this is like, who cares? Like, anybody dying? No. Okay. Well, we'll figure that shit out. We got time. Like, yeah, okay. Well, we'll figure it out. We'll fly by the seat of our pants. We can do that. And what I realized was what she wanted to see. She wanted to see me getting excited. She wanted to see me be like, oh my gosh, we got to do this, this, and this, instead of being like, just saying, okay, let's go do this. Like, we got this. So, she, and it drove her crazy. That I was like, it's fine. Anybody dying? No. Anyone blue? No. All right, we're good. Doesn't have to happen right now. So, and even now, my boss now, same thing. Like, she's like, sometimes gets a little intense, and I'm like, we'll figure it out. I remember not that long ago, she goes, hey, you're teaching this class, right? And I said, yeah. She goes, have you ever taught that? I said, no. She goes, well, how are you going to teach it? And I'm like, I don't know. I'll figure it out. She's like, well, have you looked at the material? I go, no, I'll probably look at it tonight. She's like, tonight for tomorrow's class? I'm like, yeah, we'll get it figured out. It'll be okay.
It's not like you're totally new to the material, right?
Yeah, it's like I got the material. Like, we'll figure it out. Like, we got time. So, and that's just a weird thing to hear. So,
people learn more from stories and examples than they do from text.
That's what I love about this. That's what I love about this podcast is people get to hear the stories of their past exploits, and tell the stories and share the stories and learn at the feet of these amazing nurse leaders that I've had the opportunity to have on the podcast and be part of my life. So it's cool. So.
Well, I'm glad we were able to do this.
Yeah, this was a lot of fun. I really enjoyed connecting with you, and you really do truly, like, I really credit you all the time for convincing me to join ENA. And of course that's been a thing, right? I've been a member of ENA ever since, been an active member of ENA ever sinse, including,
yes, you have.
Huh?
I said, yes, you have.
Yes, I have. Well, I think I can't thank you enough for spending time talking to me. It's been a blast catching up with you, and please know the influence you had on my career is not insignificant. So that's kind of
you're so
cool
kind
thing.
to say so.
It's kind of cool to be able to connect with you and have you on the podcast and
well, I appreciate that.
Hear your stories again, which I used to love when I was but a wee little tech running around in the blue camo pants. Do you remember the blue camo pants?
Yes, I do. And I think you were the one that christened the 60 cc syringe for water fights. Because I never used more than 12.
Yeah, I remember.
You're the one that did the 60.
Yeah, I remember. I specifically remember you saying, "Okay, if you squirt me with that syringe, you're gonna die," and I think I did anyway. Yeah, I think I did anyway. We had some good times. We had some good times that year, a long time ago. Holy cow.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.